Namaste. I am Dr. N. Manjunatha, working as Additional Professor of Psychiatry at Department of Psychiatry in MAD, Bangalore. Today I am going to talk on this video about three triplets of psychiatry, which is, I believe, is very helpful for public education, even for policymakers, which is called SAD, MAD, and BAD of the psychiatry. Psychiatry always equated with the madness in the society, and what layman term in society which people believe as a madness is the person who is a aimless wanderer, talking to self on the road, and poor self-care. This kind of person they call as madness, and unfortunately the whole madness is being equated with the psychiatry. In this video I'll try to decode this to give a better meaning for the psychiatry, and which will be helpful for the people, common man, and as well as possibly policymaker. Actually, we have more than 100 psychiatric disorders in the literature. As I already said, SAD, MAD, and BAD. The primary aim is to educate public and even for policymakers. Yes, this is the table on which I have given a description. SAD is the group of psychiatric disorder for the common man, which is equivalent to common mental disorder, which has a stress disorder, anxiety disorder, depressive disorder, even somatization disorders. Coming to BAD psychiatric disorders, which we can educate people for the people whom they call as alcohol disorder and personality disorder, where generally people will fall in category of the BAD psychiatric disorder. Coming to MAD, which commonly people think as a MAD psychiatric disorder, are a psychosis, which include generally schizophrenia and bipolar disorder. These triplets, which I believe which will be helpful for people come in a public talk or public education, this will be helpful. And glaringly, the prevalence rate of the MAD, which common man or general population believe as equal to psychiatry, is only 1% of the common populations. Coming to SAD psychiatric disorder, which is around 10% of the people are suffering. Because of the 1% people stigma, 10% of the SAD group of people are not coming for treatment. So that is why this triplet I believe will strongly helpful. Coming to BAD group of people, it is around 10 to 15% of the people are suffering from alcohol disorder and some personality disorders. Because of stigmas, madness, they are not ready to come. So I think this will be helpful. Does this triplet, which I said SAD, MAD, and BAD, will it increase the stigma? Answer is yes and no. Yes is the moment people listen this, look, especially the term MAD, it looks like that I am trying to increase the stigma. But if you give the statistics and give the explanation of this thing, people will they will understand psychiatric disorder in a better way. In that way, I think this video will be helpful for many of public. And disclaimer is that definitely this video and these triplets are not useful in the clinical purpose when you are seeing the patients or family. Dhanyavada.